Hi, my name is Deja Davis, and I'm going to be talking to you guys about anorexia. Anorexia is the mental disorder with the highest mortality rate. Anorexia is characterized by a person's irrational fear of weight gain and extreme restriction of calories. It is a mental disorder that can affect all types of people, men, women, and children. There are many different factors that can put you, your children, and friends at risk for developing the severe mental disorder. There are many risk factors, symptoms, and treatments for anorexia that can be life or death when dealing with a patient suffering from the disorder. I've done in-depth research on anorexia during my studies at FSU, mostly in an eating disorders class taught by a registered dietitian who specializes in eating disorder treatment. To begin with, there are a wide range of risk factors that make it more likely for a person to develop anorexia. Personality is one of these huge risk factors. People with low novelty seeking, high harm avoidance, and high persistence, as well as high levels of restraint, are more likely to develop anorexia, as well as people who are perfectionists and have obsessive compulsive disorder. Mainly, people with type A personality type are at more risk of developing an eating disorder, specifically anorexia, than people with a type B personality type. Another huge factor in the development of eating disorder is body image. People with low self-esteem and high insecurity tend to be more likely to develop anorexia. According to Kiel, high body satisfaction is the biggest risk factor in regards to anorexia. Even people's interests and hobbies can increase their risk for developing anorexia. According to the Lagrange study, elite athletes that participate in sports that have a large focus on body type and physique, such as gymnasts and bodybuilders, are at a higher risk of developing anorexia. And little did I know that I, as an exercise science major, am also at a higher risk of developing anorexia, according to Davis. Now, let's discuss the different signs and symptoms that can show that a person has developed anorexia. There are a huge range of these symptoms, some of which are psychological, some of which are physiological. The psychological effects are harder to tell, but they mainly center around depression and anxiety, as well as suicidal thoughts. These are mostly due to a person's severe body dissatisfaction and low self-esteem. The physiological factors are usually the ones that are more obvious to the naked eye. Some of these symptoms are sleep apnea, hair loss, muscle deterioration, malnutrition, fainting, and heart and kidney failure, as well as severe hydration, reduction in bone density, abnormally low heart rate, fatigue, and overall weakness. Basically, people with anorexia are extremely malnourished. Because they are malnourished, they are not able to fuel their body systems, which causes their body to fail. These psychological and physiological symptoms are the main cause for anorexia sufferers to seek treatment. There are many different types of treatment, but all of types of treatment have the same goals, and those goals are weight regain and reestablishing a healthy relationship with food. You can reestablish a healthy relationship with food by practicing intuitive eating. And intuitive eating is the ability to recognize your inherent hunger and satiety cues. When we're children, we all intuitively eat. We cry when we're hungry and get fed, and then stop eating when we're full. As we grow up, we get socialized to only eat at certain times and eat a certain amount depending on how much food we have on our plate. Malnutrition has to be dealt with before psychological treatment can begin, making it important to teach people with anorexia to gain weight in a healthy and positive way. There are three main types of treatment for anorexia: cognitive behavioral therapy, interpersonal therapy, and family-based therapy. Cognitive therapy is mainly views eating disorders as irrational cognitions that need to be elicited, challenged, and replaced. And according to Alec, interpersonal therapy is different because it identifies interpersonal problems that people need to work on using different techniques in order to elicit a change. And also according to Alec, family-based therapy is usually used on children who are suffering from anorexia, and their parents are the principal facilitators of change. Family-based therapy is actually the most effective, and it has a 90% success rate. All three types of therapy use a multidisciplinary approach to treatment involving psychotherapy, a medical doctor, a nutritionist, and a psychiatrist. Even with therapy, there's still a 50% chance of relapse, making the best treatment for anorexia prevention. All in all, anorexia is an extremely severe disorder that can be developed due to many different risk factors causing severe symptoms that must be treated to prevent fatality. Risk factors for developing an eating disorder range from low body image all the way to a person's inherent personality traits and hobbies. There are both psychological and physiological symptoms associated with anorexia that can lead to fatalities, and according to the person, you may use a different type of therapy depending on their symptoms and how their eating disorder has developed. Anorexia is on the rise due to the influence of media and an unattainable standard of beauty. The only way to truly deal with this mental disorder is to prevent it from happening in the first place. Prevention begins with educating the masses on the risks, symptoms, and consequences of anorexia nervosa and dealing with the media in a positive way to increase the masses' body image and body satisfaction. Overall, this is an epidemic that really needs to be dealt with, and that's why I wanted to inform you guys about different ways that you can see anorexia happen and different risk factors, as well as different ways for treatment. But overall, remember, prevention is the best way to keep someone from dying of anorexia or any other eating disorder.